Hi, very good evening. No music today as we are outdoor. I hope I'm audible. Let me know if you want me to raise my voice. Since we are outdoor, I'm not sure of the audio quality, but let me know if you want me to raise my voice. Also, let me know if you have any streaming issues, right? A very good evening, all of you. So today, as we discussed previously, I posted some information regarding today's live session this afternoon. We'll have MCQs discussion from the topic temporomandibular joint, right? Okay, please do confirm these two things. Any issues with streaming? Second, what about the audio? Do you want me to raise my voice? Okay, I'll definitely raise my voice. Is it fine now? Because before we proceed, I want to confirm this so that it will be clear and you'll be able to follow what I'm speaking out. The dogs are barking. Okay, is it fine now? Can we proceed? Okay, perfect. So, a very good evening, all of you. So, in fact, I wanted this live session at 5 p.m. because at 7 or 8 p.m. or 9:30, we will not have this magnificent view. So that you would appreciate the background, I wanted to have this live session in the evening itself before the light fades. Fine. So, we'll proceed with our first question from temporomandibular joint. Okay, so we'll start with our first question. Which of the following component of temporomandibular joint acts as a stabilizer? So we have options: condylar heads, articulating surfaces of temporal fossa, articular disc, none of the above. Which of the following component of TMJ acts as a stabilizer? So I'll pose the same question in the comment section as well so that you can go through it, right? So the first one, which of the following components of temporomandibular joint acts as a stabilizer? Condylar heads, articulating surfaces of temporal fossa, articular disc, none. So as you know, temporomandibular joint, we have left and right mandibular condyles. We have articulating surfaces on both the condylar head as well as on temporal fossa. And then we have an intervening articular disc. And finally, we have capsule along with its ligaments. So these are the basic components of temporomandibular joint. So which of the following acts as a stabilizer to the joint? So I see majority of you giving option C. It's option D, none of the above. So none of the given options provide stability to the entire joint as such. Capsule is something which plays a major role in stabilizing the temporomandibular joint and also plays a major role in allowing the condyle to perform its complex movements. So capsule along with its ligaments provide stability as well as support. So option D, none, is right answer. I hope it's clear, right? Option D. Exactly, capsule is right answer. Okay, we'll have our second question. Second question. The upper and lower compartments of temporomandibular joint are associated with gliding and hinge movements respectively, hinge and gliding movements respectively, hinge movements only, gliding movements only. So which of the following is more appropriate? The upper and lower compartments of temporomandibular joint are associated with which of the following options? So you can see the same question in the comment section now. So basically we have temporomandibular joint cavity. This cavity is divided into an upper compartment and lower compartment by an intervening articular disc, as you know. We'll discuss about articular disc, capsule and ligaments in the subsequent questions. So this articular disc divides the entire TMJ cavity into upper and lower compartment. So what kind of movements do you see in upper compartment and what kind of movements do you see in lower compartment? In upper compartment, there is gliding movement between the condylar head and the articular eminence, and in lower compartment there is hinge movement between the condylar head and the lower surface of articular disc. So you see option A, gliding and hinge movements respectively. Gliding movements in upper compartment of TMJ and hinge movements in lower compartment of TMJ. Option A is right answer. Hinge and gliding movements. Wonderful. So also you can see, I'll show you the image of a cross section, a longitudinal section rather of a temporomandibular joint where you can see upper and lower compartments. I hope you can make out, right? So you have an upper synovial cavity, a lower synovial cavity. So in fact this entire cavity is divided by articular eminence into upper and lower compartments. So you find gliding movements here between the condylar head and the articular eminence in the upper compartment, and in the lower compartment you see hinge movements between the lower surface of articular disc and the articular surface of mandibular condyle. So this is an image, a representative image of various cavities in TMJ. Fine, I hope it's clear. So we'll proceed with our next question. The third question is commonly asked in several exams previously. So we'll try to focus on the same now. Third question is related to articular disc. Articular disc is vascular, avascular, both, none. So which option would you choose pertaining to articular disc? As you know, articular disc is nothing but a band of collagenous tissue. It's a fibrous tissue, a band of collagenous tissue which is present between the articulating surfaces of the temporal fossa as well as the mandibular condyle. And as we discussed previously, it divides TMJ cavity into upper and lower compartments. This articular disc is very much essential as it is lined by synovial cells which form synovial membrane. This synovial membrane is responsible for secretion of synovial fluid which in turn is essential for lubrication and for various diverse movements of condyle. So that's one of the essential functions of the synovial membrane covering the articular disc. Articular disc is thin and avascular in center, whereas it is bulky and vascular in the peripheries, right? Option C is right answer. It's both avascular and vascular. If you remember in the previous image which I have shared, which I have shown you, you can see the central part which is very thin and avascular. The periphery will be bulkier and vascular comparatively. Fine, I hope it is streaming fine. Yeah, we had some streaming issue. Okay, how is it going now? Am I audible? Okay, now it's fine. Okay, we'll quickly proceed with the next question. I'm not sure how the signal is going to be here, so let's make it as fast as possible. I hope it's clear, right? Articular disc, option C is right answer. Okay, we'll proceed with our penultimate question. We just had 5 questions, so that we can complete the session within a span of 20-25 minutes. So penultimate question of today's discussion. The capsule of temporomandibular joint is laterally strengthened by option A, spinomandibular ligament, stylomandibular ligament, temporomandibular ligament, option D, all of the above. Which of the following ligaments strengthen the capsule of TMJ laterally? As we discussed previously in the first question, capsule is one of the integral components of temporomandibular joint. And capsule along with ligaments provide or reinforce the structural stability as well as support to entire temporomandibular joint, allowing the joint to perform various diverse movements. Just hold on, I think again there is some streaming issue. Yeah, my mobile is draining, literally it's draining. I just have 10% charging. It has come from 85% to 10%. I don't know what the issue is. Yes, temporomandibular joint, also called as lateral ligament, which reinforces the lateral aspect of capsule. Option C is right answer. Okay, we'll do our final question. Yes, temporomandibular ligament, or it's also called as lateral ligament. (85% to 10%). Okay, final question. Vascular supply of temporomandibular joint is derived from deep temporal artery, superficial auricular artery, posterior tympanic artery, descending pharyngeal artery. Which of the following is more appropriate pertaining to vascular supply of TMJ? I'll repeat the options: deep temporal, superficial auricular, posterior tympanic, descending pharyngeal artery. As you know, neural supply is derived from auriculotemporal, deep temporal and mesenteric branches. We had discussed this previously also. What about the vascular supply? I am really sorry, there is no right answer in this question. It's not deep temporal but superficial temporal artery. It's not superficial auricular but deep auricular artery. It's not posterior tympanic but anterior tympanic artery. And it's not descending pharyngeal, it is ascending pharyngeal artery. So these four provide vascular supply to temporomandibular joint. So none of the given options is right answer. Okay, it's a hunch to make you land in soup. Yeah, I think some of you have answered it right in form of comments. Wonderful. So the vascular supply is derived from superficial temporal artery, deep auricular artery, anterior tympanic artery, and ascending pharyngeal artery, and neural supply from auriculotemporal, deep temporal, and mesenteric branches. So none of the above is right answer. Fine? Okay, I hope it's clear. We'll conclude our session here because we have an unreliable signal in this area. So see you again in another live session. We have more and more sessions coming up this week, and also we'll have more and more subject-wise discussions as well as general discussions, as many as possible incorporated this week. I'll update you the same in WhatsApp and Google Groups. Fine. So see you again. So before I put an end to this video, I'll just span the cam towards the entire valley so that you can just have a look how beautiful it is. By the way, this is a place called Kempty, which is around 10 kilometers from Mussoorie, Uttarakhand. So before my mobile switches off, I'll just pan my cam so that you can just have a look at the entire valley. So this is a place or area called Kempty, which is 10 to 11 kilometers from Mussoorie. You're all welcome. And we have two pets here. I'll just zoom in. You can see there two pets. They were fighting till now. Names are Bonky and Shadow. Bonky, Shadow. Okay. So I'll just zoom out and pan cam once again. So these are actually lower Himalayan mountain range, I reckon. Yeah, before the light collapses, I'll just show you this particular place. This is really very aesthetic. You can see the kind of cultivation. What do you call it? Step cultivation? I reckon it's kind of step cultivation where the locals here cultivate their own food. Yeah, you can even see here on to my left. Yeah, this is another step cultivation. You can see they have been working throughout the day. It's been very sunny, at the same time the climate is extremely cool. Yeah, step cultivation. And this is my favorite view. Fine. Yes, Pirjada, definitely I'll visit Kashmir as well. Definitely. Thank you for your what do you call suggestion. Okay, fine. See you all. Bye. So keep a tab on WhatsApp and Google groups. We'll post all updates over there. And also I posted one video regarding the total number of MDS seats in India. Do go through it, and you have any further queries, you can drop a mail at proudtobedentist@gmail.com. Wish you all the best. Love you all. Bye.
Bye, sir. Love you.